Welcome to another episode of the John McEntyre Show live, Money Show live, prime time. I'm John McEntyre. And you know who I have here with me? This is Andrea with me. Sorry for maybe it might have been some technical difficulties with some echoes there, but when you see Andrea, you know we're going to talk about Medicare, right? Right. So um, we're talking about we're in the AEP is definitely crunk up big time, and everything is rolling, seriously rolling. We don't have to do any Medicare wallet wins because we're seeing that people are enrolling, they're finding the plans they're looking for, and everything like that. So they're really taking care of business.
Yes, the
Everything is
annual
business, right?
enrollment has been
Yeah.
very busy,
Mm-hmm.
and I've been out and about like errands, and I've overheard some conversations. You've got different people talking about what their plans are for the weekend, and
Mm-hmm.
a lot of it has to do with fall preparation. And I was really surprised to hear some people were saying we're looking over the benefits, or I'm supposed to be getting together with my mom
Right.
to help her look at her plan because she wants to make sure she doesn't mess up.
Right. That's
So
right.
kudos to everybody helping out and being that advocate and listener to make sure that everybody's tapping into resources.
Yep. And so that's good that you mentioned that because we are get the questions, people making comments, things like that. And one that came up um, a few times, which was about actual mental health today, mental health actually
Mm-hmm.
being covered. And what really triggered it on me to make me want to cover it today is because uh, I was talking about my dad. He received a call,
Yes.
and once we talked deeper about the actual call, he told me, he said, I was like, okay, so what was this about? They said they were just asking me certain type of questions. And, when they get a certain age, they just say what they feel. He said, they were talking to me like they were trying to figure out if I was crazy or not. I was like, no, no, they were just doing a
Oh,
checkup. That's what they
mental
were doing.
capacity.
Right, right. I said, because, they look at your files and things like that, and they tailor questions
Yes.
to what's going on in your file. And once I explained it that way, he was like, "Oh, okay." And I showed him in his file, where some things that wasn't major concern, but they were just watching, just monitoring, doing some monitoring.
Mm-hmm.
And he was like, "Oh, okay." And so he was like, "So Medicare, it even takes care of stuff like that?" I said, yes, it does. They actually have services. Those are some of the things that they cover. And then it's like some other people ask the same question, because some people when they're aging, they think one thing is wrong or something like this, and they just want to make sure.
Right. So I'm glad it's we're going to discuss that because so a lot of people get confused.
Yeah. Oh
What's
yeah.
covered, what's not covered, or maybe they think something is just getting older, but it could be symptoms of something else.
That's right. And so that's what we want to do today because a statistic shown by the World Health Organization, they reported that approximately 15% of adults age 60 or older actually suffers from a mental disorder that is not part of the normal aging process.
Okay.
It's just not, um, we all say that, what is the saying? I'm having
Oh, senior
my
moments.
senior moments or whatever.
Mm-hmm.
And so they're saying, though, actually 15% of the adults over 60, they're not having just senior moments. They can't be easily classified as just senior moments. There's something else that could be going on.
Mm-hmm.
And basically, sometimes it can be hard for older adults to, separate the signs of mental health problems from the actual aging
Yes,
issues.
body
Yeah.
aches, or just sometimes it may take you a little bit more time to do certain things. Maybe you don't have the strength, or um, it just could be
Or
anything.
sometimes it's they may think that they're feeling sad or anxious, that that's part of the normal part of aging, when in actuality that could be something else. you
Yes.
know Especially when living with challenging health conditions, or especially if they lose loved ones. That's when it really
Yes.
gets serious. So declining health and the challenges of managing multiple diseases and issues can put seniors at risk for mental health conditions like depression and anxiety.
Yes. Hmm.
So well, that's why we want to do the show. So if you're struggling with, God forbid, thoughts of suicide or constant feelings of sadness or hopelessness, it's time to talk to a doctor about getting the help you need. And the good thing about it is Medicare covers a wide range of mental health services.
Yes, I was really pleased to really learn the depth of coverages that Medicare provides,
Mm-hmm.
and one of the main ones is the screening,
Mm-hmm.
because the screening, that's the first step. They really want to evaluate um, your moods.
Mm-hmm.
They want to make sure, because sometimes your moods could be impacted by the medications that
Right.
you take, and sometimes the medication, you're taking multiple medications, and they can actually have side effects with one another
Right.
that is causing you to feel or behave a certain way.
Right.
So those screenings and asking you lots of questions and looking at your medications
Mm-hmm.
and your overall health, that is the number one way that you and your doctor can, decide what's really going on.
Right. Even if you don't have symptoms, well, like I say, with my dad, they were looking at his charts and they noticed, like his appetite thing was going on, and we all know um, we're healthy. We're
Mm-hmm.
healthy. You know, youthful folks. I get hungry. My diet gets wrong. I can get cranky.
Oh,
I
absolutely.
can have mental health issues, and I'm not being funny. I can get serious. I'm being
Age has
serious.
nothing to do
Age has
with
nothing to do with
being
that.
hangry.
Right, exactly. Hangry is the word. Well, with the aging, it could actually just be that.
Yes.
Sometimes, they may get busy or maybe taking a certain medication, like you said, it could affect their appetite, things like that, which could cause other symptoms to start to happen.
I know there's one symptom that's common with certain types of medicine is it can make you sleepy.
Hmm.
Well, if you go to sleep and you've went past your normal eating time, you're going to be very irritated.
That's right. So that's one of the big ones. Next one is therapy.
Yes. So
You know,
let's say if it's not related to just normal things that are going on, and during the screening process something is uncovered, therapy could be one of the recommendations
that's right.
to get a handle on the situation.
That's right. And Medicare covers individual and group therapy, psychotherapy, and family counseling. And I know that personally from being involved in some of those types of family counseling things, just so that everyone is in the same room to understand what's going on with the actual beneficiary. While they're having these conversations, and then this is for the caretakers out there that's helping to take care of the mother, the father, or auntie or close friend of the family, or someone
Grandmother.
like that, grandmother. you know you can be involved. They want you involved, as a matter of fact. They
Yes.
want you to be there. It
I'm
was stressed to me. Please, we would really like for you to make these meetings. And I know that you're very busy and things like that. I was like, no, if it needs to be here. And it was very beneficial. It wasn't therapy. It was just at a screening, and they automatically sent his next the report came up, in much better spirits, much happier. Always been cooperative, but extremely cooperative. Is has seemed like hope has went up, things like that. There you go.
hope up, frustration down.
Hmm.
Those are all
Confusions
mm-hmm,
not as bad. Memory is actually improving, things like
mm-hmm.
this. So those are good things to actually know what's going on. So if they're having to go to therapy, know that that's covered.
Now, before we go on to one of the other services,
Hmm.
therapy therapy and mental health is something that it's always been a concern. It's always been something that everyone should be aware of. But we absolutely know within the last 5 years,
Hmm.
since, post pandemic, and
Yes, yes.
also with, the U.S. economic and political atmosphere, and there's
Yes.
just a lot of things that have been going on that has brought to the forefront that everyone should be really paying attention to your family and friends. And so we want to make sure that we're not forgetting the caregivers, and we're also not forgetting those aging parents and elderly, because some of those things could mean that they need some additional support and services. So don't be afraid of the word therapy.
Right. That most definitely. I mean, this climate that we are in now, that we've been in for the last 5 years or so,
Yes.
it has affected even the babies.
Yes.
So now we can understand, healthy babies, middle age, teenagers, 20 somethings, 30s, all the way up, middle age. So everyone has been affected.
Yes.
Everyone has been affected. So that's why therapy has actually, went up. I mean,
Hmm.
even with us, we're a personal finance show, but we've been taking classes about financial therapy, even though we
Yes.
always have. But they're like bringing them to the forefront of, when people are depressed, they may waste money, they may forget to pay bills, they may do this. You have to watch out for this type of stuff. So
Yes, and within our industry is very much talked about making sure that you are looking out for the best interest of, your senior and aging clients, because you want to make sure that if they're doing something that's out of the ordinary,
mhm.
that you're paying attention, and that you are bringing in those additional maybe financial power of attorney, or
Right.
making sure that you're tracking, is this normal for them?
That's right. That's right.
So
So, like you said, there's nothing wrong with therapy. The next one covered inpatient and outpatient care. Medicare covers, the inpatient hospital stays, partial hospitals, intensive outpatient services. So, and that could come into play with mental health issues. Just say, someone, they may be something could trigger them and it sends them into maybe dementia or something like that. Well,
mhm.
those types of services are covered because they may have to do the inpatient hospital stays because of this, or maybe their depression or something like that is a little extreme,
Yes.
and so they may need to be observed, going,
Mm.
stay for observation. Well, it's taken care of, it's handled.
Yes. So it's wonderful benefits. We want to make sure that you're taking advantage of them.
Yep, yep. So the next one is medication.
Hmm.
Well, know that Medicare, that covers the medication management and certain prescription drugs in that particular area.
Hmm.
Um,
Of mental health support.
yeah, mental health support, mental health, preventative type medications, things like this. Whatever the doctor prescribes,
Yes.
yes, we have to look into those.
Hmm. And we've talked about the Part D plan and those medications. Well, if there is anything that needs to be looked at within the formulary, or any type of options, that's definitely, it's good to know that those are covered, and your Part D would have those in there as well.
That's right. That's right. The next one is diagnostic tests, and that's what my father, he was had that meeting and they was talking to him. I was like, they were just making sure everything was fine, because it is a test to determine if you're, number one, making sure you're okay, and also making sure that you're getting the services that you need.
Yes.
Because the doctors take care of, but then carriers, they also have nurses and doctors and people, especially the big carriers. Well, pretty much all the carriers do, but especially those large carriers, the
Hmm.
Aetnas, the Humanas, the Cignas, WellCares, they have on staff type people that may come out to visit you, and talk with you, or at your appointment, they may be present at your appointment with your primary care physician. It
Yes.
depends
Yes.
on what type of plan you have.
So don't be alarmed if
No.
they're doing those calls. Just think of it as it's Medicare's version of your mechanic. They're wanting to just make sure everything's working, and they're going to ask you a lot of questions, not to trip you up or trick you, but
No,
just to see
no.
how, if everything's firing.
That's right.
Right.
Make sure everything is okay. And also what they're doing, they're also doing research.
Hmm.
Okay. This year, like mental health type issues went up 15%, 20% from
Hmm.
last year. Okay. Then the plan needs to respond to that. So
Yes.
in this particular zip code, we need to be more specific with this type of a plan,
Hmm.
because these plans are year by year. The Medicare Advantage, because that's what we're mostly talking about right now. The Medicare Advantage plans, is that's what they do. They respond year to year,
Yes.
on an annual
Yes.
basis. Some plans that was not offered in certain zip codes, 5 years ago, is like the main plan now,
Yes, so
because of the
they're
population
responding
changing.
to
Mm-hmm.
what's needed in that
Mm-hmm.
particular zip code and area, which is why we've been talking about when you're talking with friends and family that mention the plan or something that they're on. That's great. They're giving you that information. You have to double check to see if it's available to you.
Right. That's right. That's
Hmm.
exactly right. That was an excellent point. And so next one, we they handle behavioral health integration, which means they may pay for care management services to help manage behavioral health conditions, which it may mean in-home care,
Yes.
someone to come, stop by, um, every so often, or whatever is called for. Everything goes to the doctor, whatever the doctor recommends. Then Medicare, see, they handle parts of it, or whatever. That's all decided as you move forward with
Ye-
that. So,
yes, yes. So that I like when you mentioned it could be in home, it could be phone call,
hmm
so they can do
yep, virtual,
virtual.
yeah, right. It could
Hmm.
be Zoom calls, anything. Yep, yep. I'm glad you brought that up also, because we have to. They responded very well with that. Like, you don't have to wait till you get to the doctor. If you're able to, if you use your phone has the capability. Or if you have a computer, we can set up a telehealth
Yes,
conference, and that's very convenient, because not everyone has to be in the same room, or the
yes,
same house, or the same state, or whatever. You can call your child or grandchild and say, "Hey, I need to be on this call with my doctor's telehealth." Okay, there you go. We're doing a Zoom call.
yes. And what I like about that is it helps those who may not be um, either as mobile,
Mobile, right?
or there could be some limited resources or something like that, that maybe they don't have assistance to get there travel wise. So this is a great way for you to leverage technology. So
Mm-hmm.
don't be afraid of technology, and you can ask the family member or the grandchild or something like that to help you with that. But leverage the convenience of using technology, because
Mm-hmm.
it really helps you still get what you need done faster.
That's
Because
right.
at the end of that call, all of your doctors and your records and everything are updated. And if there's any prescriptions or refills or things like that, they're able to document that and they can submit that over to the pharmacy. Or it's just a good update that they're like, you know what? You're in really good spirits. What's been going on
That's
lately?
right. Just a conversation.
Mm-hmm.
Just having a conversation, not being interrogated or
No.
anything like that. It's just a easygoing conversation, and everyone's just that's centered around you,
Mm-hmm.
the beneficiary. And so, one of the last ones, with this is not an exhaustive list, but the last one is cognitive behavioral therapy. Um, if you did need that type of therapy, where you needed to do some, maybe there was some behavior changes that needed to be worked on, well, Medicare Part B can cover those therapy services when appropriate.
Mm-hmm. So this reminds me of a client that I had worked with, and they actually experienced a stroke.
Mm-hmm.
And so they went through the physical rehabilitation and everything,
Mm-hmm.
but they had to have some cognitive, therapy to
Mm-hmm.
really help them um, get back to the basics with, you know, talking and being able to read and structure things,
Oh yeah.
because
Mm-hmm.
the stroke had caused a little bit of a delay. So they were wanting to help them.
Yes, strokes ought to be taken serious. Those are serious occurrences. So yes, so we all know that with that. Now that's Medicare, because we have to remember that the Advantage plan has to provide everything that Medicare does, and then some. It says, okay, we're going to cover this, and then we'll add some extra services. So all of this that we were just discussed is what Medicare does.
The basic original
This
Medicare.
Is basic original. Now, if we go into a Medicare Advantage plan, also known as Part C, it may offer additional mental health coverage. So that's why it's important to make sure to review all the options when you're looking at plans. That's what we was talking about here, is making sure, because like I said, going back to my father, some of the things that being handled, the plan itself is taking care of that. It's like the extra services.
Yes.
Some of them that you mentioned, you mentioned, for instance, the meetings, going to the doctor, things like that. Even though his doctor's office is close, and one day he tried the thing, I'm just not feeling like driving today. I said, well, your plan will pay for it. They'll come and get you. Oh, I'll just go ahead and drive.
I don't understand why he didn't take him up on having the Uber service.
He just did not want to go. That's all that it was. He just did not want to go. And so I was like, no, I've looked at your plan, my man. It's a whole lot of services, we're actually looking into more of them. He didn't know that was going on. And that actually segues into our question of the day, because when you have these plans, if you have a plan and you're wondering about these services, it's in your summary of benefits. You have to look into your summary of benefits. So when I was there with him, I whipped out his summary of benefits and I said, see, if this goes down. He was like, oh, they do a lot, don't they? I'm like, yes, they do a lot. So you can't get out of this. You cannot get out of this. So you may as well just play ball. Let's just play ball with it. He was like, okay, cool, let's do it.
Well, if we're going to give everybody homework, I think you should show them the question of the day.
Yeah. So we were talking about the summary of benefits. So the question of the day is, do you really read the summary of benefits in your Medicare Advantage plan? Have you read them, or are you going to read them?
This is not a call out, because we're guilty of it too. Many times we don't look at all the details until we're trying to see, does my plan cover this?
That's right. And there's nothing wrong with it.
No.
I should have put in at the front of, do you know where it is?
Do you know where your booklet is?
Yes. Do you know where your summary of benefits, where it is, and have you read it? Those are two good questions. And that is something, it is like I refer back to my father, because this is like my journal chronicling. When we do these Medicare shows, I'm sharing like what I'm actually going through, because I'm playing part caregiver right now. And so I set up, okay, let's leave this right here beside your chair. So if we talk, I say, hey, where's your package? I don't call it summary of benefits. I said, where's your package? Oh, it's right here where you put it. And he was like, I got it. I'm looking at it right now. And I was like, okay, good. That's good. And if you don't read it, if you're not, it's good bedtime reading. It's like the Medicare and You book. It's good bedtime reading. If you're having a problem going to sleep, whip out that summary of benefits. By page 2, you're in La La Land.
It is a lot of information that can be for good bedtime reading, but it's also good if you're wanting to find out, is that covered? Is something covered? And if you don't feel like looking it up, you can always look on the back of your card, call your provider, and you can just ask them questions. If you like doing research on your own, then you can also go to their website, and they have they have the summary of benefits, but they also have what's called an FAQ, or common questions. And these are questions that they know people have either already asked or that they want to make sure you know.
Right. That's right. And that's to let you know there is no such thing as a dumb question.
Correct.
The dumbest question, like has always been said, is the question that hasn't been asked. If you don't ask it, That's the only question. And so we hope that the information that we gave was beneficial to you. And if you have any more questions, our information is on the screen there. Andre, I want to thank you for being on with me on our Medicare Friday, sharing this information. Um, and we'll be back next Friday, right?
Yes,
Talking
next
about
Friday.
more.
Always fun, always a pleasure, and I look forward to hearing more about the Chronicles. You guys get the short side of the story. I
Oh
usually
yeah.
get more meat.
Oh yes, yes. We get a lot. We get to talk. We have fun with this one. Yeah.
Mhm.
Um, but if you have any questions, contact us. If you have, you can share those wallet wins. Let us know that you've enrolled in your plan. If you have, let us know what plan you have and if you're happy with it. That's
Mhm.
always important. We want to know those things. Go and share it. Share it on our social media page. Go there and share those types of things so that other people can see it, interact with it, and
Mhm.
then that way we have a community going. You're not in this by yourself.
Exactly.
So if you don't have anything else, then we'll close it out.
I'm good. Thanks, John.
All right. So that being said, we will see you Monday, same time, same channel. Have a good evening.